Hi, I'm Mary Wiley. I'm from Bakersfield, California. I'm a CNA, and I support 2079. Thank you.
Great, thank you.
Hi, I am Michelle Lopez-Cibulo. I strongly support AB 2079.
Thank you.
Hi, my name is Pauline Grant Clark from Fresno, SEIU 2015 member, and I support AB 2079.
Thank you.
Hi, my name is Tom. I'm a CNA. I'm working as a CNA for over 20 years. Now, as a CNA, I work to take care of this resident physically, emotionally, and spiritually. Because of this kind of this job,
just your name, please.
I
Just
have
your name.
to
Thank you.
learn how to take care spiritually to reach the goal of the
Thank you.
Amen.
Hi, I'm Latrina Favors, Sacramento. I've been a healthcare worker for the last 20 years. I am a strong supporter of AB 2079.
Thank you very much.
Arnisha Tillman, resident of Antioch, California. I strongly support AB 2079.
Great, thank you. Anyone in opposition? Please come forward.
Mr. Chairman and members, let's go closer. Mr. Chairman and members, John Latimer on behalf of the California Association of Health Facilities. We are in opposition. Unfortunately, we find ourselves opposing this bill and appearing to oppose this workforce. We don't. They're incredibly valuable to our industry. The problem that we have with the bill is that it presumes in our industry that one size fits all. Nothing could be further from the truth. Every single facility that we have staffs at a very different level based on the needs of the patients in that specific facility. So we have not, as an industry, supported shift ratios. We think that it ignores the evaluation that is required of us as providers and also required by CMS to staff according to the need of that patient population. So you may see facilities that staff minimum nursing hours up to 4.2. You may see them down at 3.7, and they're all over in between based on the needs of that specific population, and that is a CMS requirement that we have to follow. It is also reflective of the patients that we're now seeing. So the concept of shift ratios, very hard for us to get on board with, because while we would like more staff, it doesn't reflect the needs of the population that we serve. That is our belief. In terms of more staff, we agree with the author and the desire of the proponents to have more staff come to the buildings. The problem is, and in fact the need relative to population bears itself out. We know that we're facing many thousands of people who will be turning 65 in the coming days, and more importantly, even the population is turning 85. They're coming to our facilities. Assemblymember Brown likes to talk about this as the silver tsunami. In the industry, we are acutely aware of it, and we need to staff more staff in order to continue to provide the services our folks need. Unfortunately, this bill doesn't help us. I'm sorry. I thought it was fairly multiple testimony. It took a little while. I apologize. I'll speed it up a little bit. But I do know that again, in the case of our facilities, we have to work to find a way to find more staff for these facilities. There isn't simply a requirement that staffing go up doesn't mean that we're going to find those bodies. Their OSHPD data, the Office of Statewide Health Planning, estimates that right now, by 2022, 5 years from now, in the state of California, we need 22,000 more CNAs. So if this bill were to pass, our estimate is it would require the industry to find another 10,000 CNAs. So the problem that we have is, where do we find that workforce to meet a demand and a need and a structure we don't necessarily agree with, but where do those folks exist? And that is why 3 weeks ago when this bill was first up, we had sent around a letter encouraging the author and the committee to consider a wage differential for CNAs, because we think you have to build the workforce, build the demand, and frankly develop the professionalism attached to the profession so that we can get people to come in and stay. So we would like to work with the author. Unfortunately, the structure at this point in time we don't think is reflective of the demand in our facilities, and we don't think the folks are here. I'd like to turn it over to, we brought one of the administrators from one of our facilities. Samantha Lallier is an administrator up in Humboldt County, and she has acutely dealt with this problem of attempting to find and maintain staffing in a facility today.
Good afternoon. My name is Samantha Lallier, and I am the administrator of 2 skilled nursing facilities in Humboldt County. One is a 60-bed and one is a 104-bed facility. I have been an administrator for 6 years in these facilities. I am opposed to this bill because it is a cookie-cutter approach that does not do what the intent is. In just my 2 facilities, the resident population vary and staff ratios are different. We all agree that we need more staff, and they should be paid well and appreciated for their hard work. My nursing staff are the eyes, ears, and hearts of my facilities. They're the ones who hold my residents' hands during their last breaths and keep them smiling every day. In May of 2015, my Pacific facility had a zero deficiency survey, which is a great accomplishment. I did not do that. My staff did that. Humboldt County has an approximate population of 134,000 people. In Humboldt County alone, there are 6 skilled nursing facilities, 4 acute care facilities, 2 home health companies, and 20 assisted living facilities. This mixed with the rural area has created a never-ending issue of finding, maintaining, and keeping our loving staff. In February 2016, our 5 local facilities spent $250,000 on just salary and housing for 50 traveling nursing staff from 3 different nursing registries as far away as Florida to get CNAs, RNs, LVNs in order to meet our current staffing ratios. As of today, we have 36 CNA, 9 LVN, and 12 RN positions open and available. In order to compete with the local market, in November of 2015, we raised all CNA and licensed vocational nurses $2 an hour without the request of the state, and $3 for RNs. Still, we're using registry because the staff simply does not exist. The local four-year university closed its doors to the RN program in 2011. The local JC has extended both their LVN and RN programs by 6 months. Never in the 12 years I've been involved in these 5 facilities have we ever had licensed nurse openings. Because of staffing concerns, these facilities do not run full, and we are forced to turn away residents who have now become as far displaced as LA. Not because we don't have a bed, but because we do not have the staff to meet full staffing requirements. Just Easter Sunday, my facility in Fortuna took a resident who was displaced from his wife of 40 years all the way to Roseville. Not because there was not a bed available, but because we did not have the staff at the time of discharge to take him. This is an example of the limited beds available in Humboldt County. If this bill is passed, staff and skilled nursing facilities will be forced to close their doors, not because they can't or won't pay for the staff, but because the staff does not exist, not just in rural counties like mine, but in the entire state of California. Thank you.
Thank you very much. Others in opposition?
Jed Hampton on behalf of Leading Age California, also in opposition.
Thank you.
Jean Hurst here today on behalf of the Association of California Healthcare Districts. We align our opposition with the California Association of Health Facilities.
Okay, thank you. Okay, questions or comments from the committee? Ms. Burke.
I just have a question. So how do you plan on addressing the lack of workforce issue? I mean, in theory, obviously, I support the idea of more hours and the better ratios, but clearly there is a workforce issue, and I think both sides tend to agree to that.
Yeah, I think the whole point of this bill is that there's a problem. And, you know, there's the problems that were described by the Attorney General's office. There's the problems that have been described by the members. There's just there isn't enough help. You have nurses that are in facilities that don't feel like they have enough there so that they can get the job done. And we recognize that there are challenges to this bill. I mean, you know, But it's all about perspective. I mean, when it came to renewable portfolio standard, it was always billed as something that was going to be a job creator, something that we could use to invest in and create jobs. And that's how we see this bill, as starting a conversation to how do we get to the point where we can have more staff. I mean, we've talked to the opposition. We tried to find some ways that we can maybe work on something coming to this committee to address some of the members' concerns. Essentially, the response that we got was, well, we oppose your bill wholeheartedly, so we're not going to really provide you with any amendments. That was the response that we got. And so I'm more than happy to continue to work with the opposition to try and find ways that we can work this thing out. But when I came here day one, I worked on, with the Department of Social Services, more like against them for a while, to try and increase our inspections to community care facilities. They said we couldn't do it. It's too expensive, not enough resources, to the point where 3 years later, the governor put it in the budget, and for residential care facilities, we were able to get inspections to once a year from once every 5 years, and then increase that for child daycare facilities. So as a legislature, we have to decide what is important and what we're going to do to invest to make sure that we do fill these needs. I'm not saying that they don't have legitimate concerns. I think we all recognize that there are shortages and that there are issues when it comes to this specific issue. But what we're saying is we have to push the issue, and we have to start this conversation, because nobody is willing to have this fight. Nobody's willing to have this conversation. There is a deficiency, and we're trying to close that deficiency in any way, shape, or form that we can work with them. We're not trying to hurt them. It's all about the patients that these nurses are having to care for, the most vulnerable in our society, that a lot of times or sometimes are not getting the care that they need or deserve because of the staff to ratio hours. And so we're trying to fix that issue as of with this bill.
Mr. Chairman, if I may, again, John Latimer on behalf of the California Association of Health Facilities. I appreciate Ms. Burke's question, and I appreciate the author's response. This is a several $100 million plus proposition. The state of California is the payer for 2/3 of the residents in our facilities. The federal government for approximately the other third. So the state of California is a customer. And if the state of California would like to work with us in partnership to develop a workforce, we're quite inclined to do so. It's going to take more than a piece of legislation, however, that says by date certain you must do the following. We can't create them from whole cloth. The customer has to work with us. We have to get the educational system involved. We have to develop a career ladder, and frankly, to find a means to continue to create, and then retain staff in our buildings. It's a collaborative process. This bill doesn't feel like a collaborative process at this point. And you're right, Assemblyman, we don't have an answer to that. But I would note that a few authors prior to this, Mr. Bonta had a workforce bill and was attempting to talk about how to do that in a collaborative fashion. We would look for that opportunity. We don't have the answers either. To be sure, we don't. We've been trying to staff these buildings, as you've heard, for some time. But we are more than willing to continue the conversation.
Okay. Mr. Rodriguez?
Yes. Assemblymember, I'm a little torn. I see the issue on both sides because of my experience in the EMS. It's kind of funny. A lot of the folks from Southern California, I've been to a lot of those facilities, so I've seen firsthand what you go through, the day-to-day operations, whether it's in the morning, noon, at night, and I'm there picking patients up or bringing them from the hospitals. But I think one thing we're missing is the patient care comes first. We got to say that who we have there.
Excuse me, please. Please, no applause. No applause, no booing, no catcalls, anything. Thank you.
The patients that are in these facilities need the best care possible. And we're looking at one way to address it, but I think we got to look at how do we make this more of a profession, right? How do we make it so it's not a high turnover rate where these CNAs are kind of get tired of their job, don't feel appreciative because the way they're being treated or paid or whatever that. So it's a combination of everything. But I think we're going in the right direction. Assemblymember Calderon, I appreciate your bill. I look forward to helping you with that. And I like I said, once again, I would urge folks to really see what they do, their jobs, because I've been there in many of these places. Somebody talked about that lifting patients. I've helped some of you CNAs back in Southern California with that lift because you didn't have any help to take that patient out of bed or put them in bed. And while I was there bringing somebody or taking somebody, I've seen firsthand how difficult it is and some of the things that you're required to do. You need more than just one body to help you. More than just you need somebody else. So with that, I'm looking to support it and how we can also look at, like, so once again, to make this a career where people can be there 20, 30 years, not just for 2 to 3 years or months for that rather. And then we go again, have that high turnover rate. So with that, I thank you for bringing this bill forward.
And I appreciate your comments, Mr. Rodriguez. I wholeheartedly support what you're saying, and I do see this as a jobs bill. I mean, we're creating a demand, and as we know, when it comes to create jobs, you create the demand, and private industry or somebody is going to come in and provide with the supply, and that's what we're going to all work on together with the passage of this bill.
Other questions, comments?
I will move the bill.
Okay. A motion and a second. Would you like to close, Mr.?
I appreciate the time. I appreciate the discussion. I'm always going to be open and welcome to working with the opposition. I thank all those that came to testify. I thank the members for their time and respectfully ask for an aye vote.
Okay, and I thank you for bringing the bill forward. While I do have some concerns, I'd like to keep the conversation going. I have a couple concerns. One is the study that the bill relies on for numbers is old. And so I would look to the author to try to find a way to fund a new study so that we are sure that we have an appropriate staffing number. Maybe that number is too high, maybe it's too low. We don't really know. It's a 15-year-old study. I think the other concern I have is around just what one of our witnesses talked about is the challenge in some of the rural areas, especially, and I know Humboldt County well since I represent it, and it is very, very difficult. And in my world, in certain times of the year, it's even more difficult because the staff moves on to do something else sometimes rather than take care of the patients that are there, and then they come back at a later time. After their other work is finished. And so that's a huge problem for us. And it's difficult. So you now potentially have a situation where you may not have appropriate staffing at all for a period of time, and we may actually have to move a patient to another hospital just based on current staffing levels. So I have concerns about those issues, but my recommendation at this point to keep the conversation going is a due pass as amended to appropriations. And at this point, I'll ask the Secretary to call the roll. And did you have accepted the amendments? He did, yes. Thank you. Thank you very much, Mr. Calderon. Thanks.
Wood?
Aye.
Wood, aye. Mainshine? Bonilla? Burke? Campos? Aye. Campos, aye too. Tababne? Gomez? Hernandez, Lackey, Nazarian, Olson, Patterson, Ridley Thomas, aye. Ridley Thomas, aye. Rodriguez, aye. Rodriguez, aye. Santiago, Steinnorth, Thurmond, Waldron, aye.
The vote is 5-0. We need 5 more. We've got a bunch of missing people, Mr. Calderon. So thank you very much, and I appreciate you making the change for us. I really appreciate that.
Thank you, members.
Thanks, Mr. Calderon. So, Ms. Grove, are you ready? Thank you.
Thank you, Mr. Chair, Dr. Wood, and Assembly members. I really do appreciate you letting me present this bill today, and I want you to know that I'm really proud to present this bill. The executive branch is responsible to execute and enforce the laws passed by the legislature. It's not to make laws or change laws, nor is it permitted to selectively enforce the laws it does not like. But with blatant disregard for separation of powers, the California Department of Managed Care officials have assumed a role of legislators, and reinterpreted a clearly understood state statute to mean something other than it was supposed to mean from the very beginning when it was passed 40 years ago. The Department of Managed Healthcare justified their actions by interpreting the meaning of the application of the 1974 Knox-King Act and the California Constitution. This illegal action in itself would be bad enough. But on top of this, the DMHC officials changed the law in which they in which a way that violates religious liberty of thousands of churches, mosques, synagogues, Sikh temples, and nonprofits and other businesses or employers in the state of California at the same time that they violated federal law. This all started when the Department of Managed Care changed its policy and threatened to punish any insurance company who sold health care policies without elective abortion coverage. It did this despite the fact that nothing in California law or in the state constitution requires private health plans to cover abortion services. And despite the fact that the federal Weldon Amendment forbids this type of discrimination, this is a blatant abuse of power and should not be tolerated. The Hyde-Weldon Conscious Protection Amendment was based on a well-established and cherished principle that no one should be forced to participate in abortions against their will. This principle established a tentative peace between those who support abortion rights and those like myself believe that there is a child involved. The Department of Managed Healthcare has completely disregarded an established principle and left every church, again, private school, synagogue, mosque, or Sikh temple, nonprofit, or business with no choice but to pay for abortion healthcare service or cease to exist. Because the law requires us to have health care insurance. Health care insurance now is required to provide abortion services. If you don't agree with it, you have no say-so. No one, especially religious organizations with moral objections, should be forced to pay for abortions with their health care plans. Not only this unconscionable assault on our most fundamental freedoms, it flagrantly violates our federal law. Ironically, California exempts certain religious employers, allowing them not to include contraceptives coverage for their health care plans, but this exemption does not exist for abortions. The Alliance of Defending Freedom has filed 2 separate lawsuits in state and federal court on behalf of churches and the faith community challenging the mandate. Those cases are pending before the court and will take some time. Also, Congress has continued to inquire about this issue, recently sending a letter to the Inspector General for the HHS demanding investigation into the processes HHS is using supposedly to investigate this violation of the Weldon Amendment. My bill, AB 2081, will simply restore the status quo and ensure that Department of Managed Healthcare follows the federal law by prohibiting it from discriminating against the healthcare companies selling health insurance policies without abortion coverage. This bill is in no way prohibits healthcare plans from providing abortion coverage. The bill just allows an exemption for the faith community not have to skim off the tops of their tithes and donations to pay for a service that they adamantly opposed and don't support. With me here to testify is Michael Faber, representing the Pacific Justice Institute, and Pastor Francis.
So I have 2 witnesses, 3 minutes each. Thank you.
So, go ahead. Yes.
Good afternoon, ladies and gentlemen of the Health Committee bill. My name is Attorney Michael Faber. I'm volunteering on behalf of Pacific Justice Institute to talk about this bill. This bill really addresses one of the emerging civil liberties issues in the state of California and the United States, which is what happens when you have a clash of constitutional liberties. How do people get along when one group has a constitutional liberty for one thing and another group has a constitutional liberty for something else? And this problem is being made worse and worse as our values are beginning to diverge as well. A free society allows individuals to choose a course of action which others may find immoral. We've seen that. But an immoral society compels others in violation of their conscience to participate in that same action. An unfair society protects the rights of some to follow their conscience while mandating that others violate theirs. That's what we have in this situation is we have the right well enshrined in the California Constitution, Supreme Court decisions of a woman to choose the right to an abortion, and yet you have the rights of other people of good faith, and Pastor Francis Anfusa will talk about that later, that legitimately see abortion as a moral wrong, as the killing of an unborn child who has a soul given by God. Who has a right to life. And what happens when you have these divergent things, we can make a peace, as the Assemblywoman talked about, where we allow each other to follow our own consciences to the greatest degree, or we can use our legislative advantage or our numerical majorities to start to impose and force the minority to not only allow but participate in things that they find objectionable and wrong. where the problem comes into place is for many of us who are Catholics and others who have other religions, is that sometimes we have a responsibility for the sins of others if we cooperate with them, participate in them, order, advise, praise, or approve of them. Employers feel like they're participating in the sin of abortion if they have to use their private money to pay for it. I would like to address the committee report made it sound like the California Constitution requires private insurers to pay for abortions. This simply is not the law. The case that was relied on, which was California Department of Reproductive Rights versus Myers, actually was decided on the grounds that government money cannot be used to make individuals receiving government benefits to give up their constitutional liberties. And therefore, recipients of Medi-Cal could not be forced to have a live birth at that time as opposed to getting an abortion, which the law tried to say would not be funded. And so this California Supreme Court case said that we can't use the power of the purse to make individuals give up their constitutional liberties. So this bill avoids that clash of values, and I hope you'll support it.
Thank you.
Go ahead, Pastor.
Good afternoon. My name is Francis Sanfuso. I'm the pastor of a church in Sacramento area, the Rock of Roseville. And I'm going to share on a personal level as well as a pastoral level. In college, I had 2 abortions with 2 women. I was an atheist at the time, did not believe in God. And consequently, I just wrote it off as a decision that was my own personal decision, didn't affect anyone as far as I was concerned. When I became a Christian, it took even a while for me to come to the conclusion that inside of those precious women was my child. And when I did come to that conclusion, it was a very significant and meaningful decision. For a long time, I referred to them as abortion 1 and abortion 2. When I realized and I accepted the fact that I would see them again, I believe that one day I will see them when I go to heaven. I didn't want to meet them and refer to them as abortion 1 and abortion 2. And so when my wife was pregnant with twins, we thought we were going to have boys. We had girls, but we had 2 names for boys, Noah and Caleb. And so I decided to name those 2 aborted children, Noah and Caleb. A couple of years ago, my wife and I were in the Sequoias, the beautiful mountains and the trees that are the largest living trees on Earth. And it was the end of winter. There was beautiful trees melting from the snow. There was no one around. And that day we had heard word that a couple in our church had had an abortion. And we recognized that maybe 25% of the folks in our church have had an abortion. It's common in our culture. And so we treat them with respect, no guilt, no shame. We just love them, counsel them, whatever we can do to help. And so, but I was sad. I knew the couple, I loved them, and was sad at the decision. They were looking for pastoral care, which we were providing for them. But as I was kind of moping around the Sequoias, we ran into only one other couple that were there. And they had 2 children, 2 little boys, whose names were Noah and Caleb. And I really felt the Lord encourage my heart that those 2 little boys that we were seeing reminded me that I would see my children again and that this couple would see their children again. In summation, I would just say as a pastor, because I believe that inside a woman's womb is a baby, and if allowed to live, that baby will grow up to be, as my children would have been, 2 men in their 40s today, Noah and Caleb. And so I would not support allowing monies to go to provide for abortions within insurance coverage. And so my appeal would be to you as legislators, and I respect your role. My father was a congressman for 5 terms. My appeal to you would be to allow individuals of conscience like myself to not have to fund abortions, since we do not believe that is the proper thing for us to do. Thank you.
Other witnesses in support? Just name. Okay. Anybody else in support? Just do name or organization. Anyone? Seeing no one witnesses in opposition, please come forward.
Good afternoon, Chair and members. I'm Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists. The reason why we are testifying here today in Health Committee is the health implications of pregnancy. This committee heard AB 508 in January, a bill to reduce maternal mortality. And I hope you remember the numbers about how risky pregnancy is, carrying a full-term pregnancy, that we have lowered the rates from 22 out of 100,000 to about 6. But for every death, there's 100 severe complications, including massive blood transfusion, stroke, hysterectomy. This is a complicated medical situation. Sometimes it can go easily, but often it does not. And when decisions need to be made, they need to be made quickly. We need to make sure that somebody has full coverage. We agree with the analysis about the relevant case law in terms of this is one of the most personal medical decisions someone can make and should not be interfered with. And we believe that the Weldon Amendment issue can be decided at the federal level by Health and Human Services and the Office of Civil Rights. Respectfully, we oppose this bill and ask for a no vote.
Good afternoon, Mr. Chair and members. Gregory Kramer on behalf of Planned Parenthood Affiliates of California, representing over 115 clinics across the state in strong opposition to this bill. This bill directly contradicts California constitutional and statutory law. California's Knox-Keene Act requires health plans to cover basic health care services, which includes a variety of voluntary family planning services. The Knox-Keene Act encompasses not just prenatal care and delivery for pregnancies, but also abortions. Any legal abortion qualifies under Knox-Keene Act's medical necessity criteria because the procedure is a clinically appropriate health care service provided by a prudent physician to treat pregnancy. The state must treat abortion and childbirth neutrally. It cannot require insurance coverage of the medical expenses for women who decide to continue a pregnancy while excluding coverage for abortion. Under both California constitutional and statutory law, abortion is legally and constitutionally protected medical option. If a woman becomes pregnant under Article 1, Section 1 of the California Constitution, the government cannot weight that choice. Further, under California's Reproductive Privacy Act, the state may not deny, interfere with a woman's right to choose or obtain an abortion prior to viability of a fetus or when the abortion is necessary to protect the life or health of a woman. If the state required plans to cover childbirth but not abortion, it would weight a woman's individual decision about how to treat her pregnancy, and it would then interfere with her exercise to a right to an abortion. So for those reasons, we respectfully urge your no vote.
Beth Capel on behalf of Health Access California, simply to note that since Governor Brown signed the Knox-Keene Act in 1975, as Mr. Kramer said, abortion services have been a basic health care service and have been included in the coverage under the Knox-Keene Act. Thank you.
Anyone else in opposition? Bring it back to the committee. Comments, questions? I'm sorry. My apologies. I'm
Brian Ortiz with ACLU of California in opposition.
Thank you.
Kathy Mossberg with the California Family Health Council, also opposed.
With that, seeing no other opposition at this point, comments, questions? Ms. Waldron?
I just have a question. I'm not sure who would be the best one. Can you expound a little bit on the state of California could be at risk for losing quite a substantial bit of money because of this? Federal dollars, I guess, for violation of the law?
Yes. Basically, under federal law, states and local agencies are not to discriminate against insurers that are declining to provide abortion coverage. A complaint has been filed with the feds on this issue, and it is under investigation. When this decision first came down by the director in 2014, the insurers were never required, private insurers, and that's one thing we have to make clear, that that what the Constitution requires government to do is different than what the Constitution requires private individuals to do. The Constitution doesn't require private individuals to do anything. Private plans have been selling plans without abortion coverage for 40 years. It was just in 2014 that the law was changed by an administrator through a letter. All we're trying to do with this bill is to take it back to what it has been for the last 40 years. Now we are in violation of federal funding, and we could find ourselves as a state cut off from federal funding because we would be discriminating against insurers not providing abortion coverage.
Anyone else? Okay. At this point, would you like to close, Ms. Grubb?
Sure. Thank you, Dr. Wood. The Knox-Keene Act, when it says the Constitution was violated, it was a law that was in place for 40 years. And just recently, last year, when the new director of managed healthcare came on board, she reinterpreted that law in order to include abortions as essential services. So I have to respectfully disagree with the opposition. This bill doesn't ask you to remove someone's right to choose. It doesn't ask you to do anything like that. And there are several bills passed every year by this legislative body that stand up and ask you to support a right to choose or a right to choice for abortion. The only thing that this bill is asking you to do is to respect and give the same dignity and respect to the faith community who has a different opinion about life in the womb, and their rights shouldn't be violated just as the opponent's rights shouldn't be violated for choice. And that's all this bill does, and I respectfully ask for an aye vote.
Okay, thank you. So we have a motion. Do we have a second? Okay, without a lack of a second, we'll come back to that at a future moment. So thank you for presenting.
Thank you very much.
Next up will be Mr. Gibson.